Morning, everybody. This is Tony Magna from Integrated Heights Healing and Wellness Center in Southeast Wisconsin. I wanted to dedicate a video on this discussion of concussions and the concussion problem and how, as it relates to contact sports. So contact sports, football, mixed martial arts, hockey, rugby, soccer, boxing, grappling. These are all sports where impact to the body is sustained. And I want to get into the discussion of it's not necessarily a problem of one impact to the head, to the cranium. The concussion problem actually lies in the fact that these sports, the athletes in these sports, you sustain hundreds and hundreds of hits to the head. And so ultimately that's what we're uncovering with the new research is an accumulation effect of multiple impacts to the head. And I want to discuss how a concussion progresses in the body, how your body responds to it, and ultimately what happens to the body. And then I want to get into a little bit about the treatment strategies of how you can basically help your body to manage and restore your body from all of these injuries. And this also includes military. These are any injury to the body, and so military is included in this as well because they sustain far greater injuries to the body than competitive athletes, and so this video can tie right into that as well. So the symptoms of a concussion. So the CDC. So right now there's 1 million high school football players. There's 70,000 college football players, and then however many NFL players. So that's over 1 million people every year that are at risk to sustain concussion. And so what we're finding and uncovering with autopsies of the brain are the long-term risks of playing some of these sports. And so some of the key concepts that we'll talk about. Number one. The brain will swell from contact sports, from sustaining multiple cranial injuries. So just like any injury site, the body will protect itself by bringing new blood flow, and it will swell the area up to protect it. And because of annual practice schedules, one of the main risks of playing these sports is your body remains in a perpetual state of inflammation. Not just your body, but your brain itself. And so it swells up. You can have bruising on the brain, you can have damaged tissues to the brain, and what we're finding is that the swelling puts cranial pressure into the skull. And with this increased intracranial pressure, the injuries that are sustained on the brain, new blood flow cannot get to the sites of injuries. And that's ultimately where we get the CTE type symptoms. CTE is a newly discovered brain degenerative disease. So CTE, the letters stands for chronic traumatic encephalopathy. And so doctors have been autopsying the brains of former football players and realizing that a degenerative condition of the brain, of dying tissues. And so the scary thing about this is it's not limited to age. And so they've autopsied 18-year-old football players' brains, and they've autopsied 60, 70-year-old brains, and they have the same type of degenerative condition. And we'll get into how that develops in the brain itself. So encephalopathy basically means a dysfunction of the brain. And so we use this word CTE to describe the degenerative disease, which is categorized. They're looking for an accumulation of what's called tau proteins. So basically these, from rapid stretching of all the nerves, it releases a toxic protein which begins to actually transverse itself through the brain. And essentially, as these proteins accumulate, the brain tissue begins to degenerate, and essentially the tissues begin to eat away at itself. So it's in a sense an autoimmune disease, and what we're finding is all of the symptoms that are related to a concussion. There's a deeper manifestation of symptoms that are often overlooked, and so we're beginning to figure out that A lot of the symptoms that athletes have come from cranial injuries. So CTE is a brain degenerative disease. One of the main suggested areas to address this problem is, well, let's get better helmets. This is not a helmet issue, okay? The brain is free floating in cerebral spinal fluid. It's buoyant. It's floating in water in your skull. And so if you have a helmet on the outside of your skull, that's fine. But within the brain, within the skull, your body can still jar and ricochet the brain inside the skull. And that's ultimately how we accumulate a lot of these injuries, is because impact to the body begins to bounce the brain off the inside of the skull. And so the better helmet you have, actually the more reckless you can be with your body because you have better armor. But the brain itself is still free floating within the skull. And that's one of the main things that people suggest. Well, we have to have better helmets, we have to have better pads, we have to have better protection. But the nature of all of these sports, it's violent, and people put their bodies on the line to compete. And so it's not, like I said, it's not a helmet issue. And so, and even if, and then another topic is to, well, let's remove the helmet, and then the sport would be similar to rugby. When people say that, well, rugby players don't sustain concussions like a football player does, I think that's a very naive statement. If you've ever seen a rugby game, it's still just as physical, and you're still getting slammed around, and bodies are still running into each other at full speed. And so, the problem is impact. And the problem is the delicacy of the brain tissue itself. And so if we're going to continue to play these games, we have to come at it from a treatment standpoint. You can put all the rules in that you want. You can put all the regulations in to try to control the game, but that's a frivolous attempt to try to control an uncontrollable game. The game is so dynamic. We can't get around this idea of impact to the body, and so that's an important thing to mention. Next, there's what's called concussive hits. So a concussion, where you sustain a concussion. So imagine you ran full speed into a wall with the crown of your head at 30 miles an hour. That's what these football players are doing on the daily, weekly. Okay, these are they sustain annual hundreds of hits to the cranium annually, and so, like I said, there's an accumulative effect. You don't have to have clinical symptoms of a concussion to sustain a bruise on the brain or a jarring of the electrical activity in the brain. And so there's what we describe as concussive hits and subconcussive hits. And so these subconcussive hits continue to stimulate the body to cause it to recognize injury sites on the brain. And when we talk about at the point of impact from a concussion, and so, okay, let's talk about the symptoms of a concussion. So according to the CDC, when you have a concussion, in the first 6 to 12 hours, so if you've ever seen anybody with a concussion, they'll have a dazed look in their eye. Their bell is rung. That's not just an analogy to try to describe it. Their brain actually can be vibrating, and so it's a good way to describe it. But it's just sometimes, yeah, your bell was rung, and people laugh it off. But no, this is a very serious condition. So in the first 6 to 12 hours, you can have memory loss. You can be dizzy. You can be dazed. You can have a headache. Often nausea and vomit come immediately when you have a cranial injury, and I'll discuss why that happens in a second. Of course, memory loss. And so when you have, at the point of impact, it actually sets a chain reaction of physiological processes in your body when you have a cranial injury, or any injury for that matter. And so at the point of impact, the problem has just begun. And so your body has set into motion to try to protect and preserve the body. And ultimately, when you do this hundreds of times, the body can no longer compensate. And ultimately, that's where we get some of the degenerative conditions. And and the chronic inflammation and all the things that come with the concussion problem. And so in the first 6 to 12 hours, you can have all these things. As it progresses, 24 hours, you can continue to have headache. And so as the brain continues to swell, the pressure within the skull increases. And that's where actually some of the headache right after a concussion begins to arise, because fluid is being pumped into the brain and there's pressure that's building up. You only have so much space between your skull and your brain. And so as your brain swells up, it pushes out on the inside of your skull, and so you can feel that intense pressure. You can obviously have confusion. The vomit and the digestive issues can continue to persist. Difficulty sleeping, and within 3 to 14 days, poor concentration, fatigue, and then psychological manifestations. I think that is one of the most overlooked aspect of this whole problem, is all of the psychological things that happen. And we'll get into that in a second. And then obviously the long-term risks: dementia, Parkinson's, susceptibility. Okay, if you have concussions, you're more susceptible to the concussion as the more that you get. Mental fog, post-traumatic stress disorder. Trauma to the body is trauma to the body, whether it's physical, emotional. PTSD is a serious condition as well, and a lot of people that sustain cranial injuries, there's often two sides of the spectrum. So there can be hyperactivity, where aggressiveness and a person is on high alert, or you can go to the other side of the spectrum where people go introvert and they get depression, suicidal thoughts, and all these things. Again, within the mind, you're sustaining an injury to the brain itself, which is the source of your consciousness. And so, again, the psychological manifestations of a concussion are the most overlooked thing, and often they try to treat it with medications, and they try to treat it with perhaps counseling, but you have an injury to the brain, and it's not truly addressing the problem. And currently, right now, in Western medicine, their main treatment strategy is pharmaceuticals. And so with that, you can mask symptoms, you can treat pain with pharmaceuticals, you can try to get the body to reduce the pain, but a Western pharmaceutical does not restore an injury site. And I think that's important to note as well, because the brain and the body from a concussion will still remain damaged. And NSAIDs and Advil and ibuprofen, even this ties into the opioid crisis as well. Okay, we throw pain medications at people that are in pain, but we don't recognize a holistic approach to the body in an attempt to restore the body. We can balance a blood panel, but the body can remain in a state of disease or injury. And I think ultimately that's where alternative holistic medicine comes into place in this type of medicine. Okay, Western medicine, they have the greatest scans, and they have the greatest orthopedic surgeons and emergency medicine. And so actually the immediate problem of a concussion is to make sure that you're not hemorrhaging. And so, but that's very difficult to determine from a closed head injury. And so often, and people do die from cranial injuries on the athletic field, mainly football. I'm talking mainly about football right now because that's the sport that I know the most about. But people have this condition in all of the sports that I listed off earlier. Any cranial injury is not good, okay? And so, like I said, if we're going to continue to play these games, we have to recognize the problem, and we have to implement new treatment strategies on how to address these issues, okay? So that's what the CDC recognizes as symptoms of a concussion. But like I said earlier, you don't have to have all these symptoms to have an injury to the brain. And that's actually where some of the psychological manifestations come, is you have an injury to the brain, and some of these symptoms begin to arise, and They think it's genetic or environmental. Yes, your environment, if you're a football player or a competitive athlete in combat sport, that's part of your environment, okay? And if you're constantly fighting throughout your day, I mean, these are combat sports. Football is a very violent sport. And so if you're fighting all day, yeah, you're gonna have some cycle. You're gonna be an intense person, okay? And often it's difficult for people to switch that off. And so, at the point of impact, a high velocity impact. This is greater than 15 to 20 G's. They're a solid smack to the head, okay? And it doesn't have to come from a direct impact to the head. You can also get hit in the body, and you can have a whiplash type movement as well, and a torquing of the body. And so actually there's greater forces when there is a rotational force with the impact as well. And so that's so there's direct impact to the body, blunt force impact, but there's also forces that from a side impact can also transverse up the spine into the head as well. And so the body is constantly getting beat up in all these sports. So when we talk about the chain reaction of physiological events that happen at the point of impact, okay, your fight or flight is stimulated. So you have these you have primitive reflexes in your body, which arose from our evolution and our development as a human. Number one, your fight or flight is stimulated. So adrenaline is released. Your nervous system becomes hyperactive. You become on alert. Your heart rate increases. Your eyesight narrows. So you're prepping for a fight. So every time you get hit in the head, your fight or flight is stimulated, and that's a chain reaction of events too. And so if you continue to do this year after year, the body again. You're like a battery. You only have so much stored energy and resources in your body. So if you continue to stimulate it to release adrenaline, you only have so much gas in the tank. And so this is one of the main things that where actually some of the psychological things come from, is the fight or flight. The person cannot switch this off, and so they remain in a state of hyper activity. And so that's one of the main things where, like I said, the psychological things come from, is the fight or flight is stimulated. Number two, when you have a cranial injury, your digestion can cease. It can stop. When there is danger to the human body, your body has all these systems that are all of the levels of the body, and your body will your body knows a priority of all of the organs, and so it will shut certain systems off to preserve priority organs: brain, heart, central nervous system. All those are priority. And so when you have a cranial injury, the digestion can just stop. And so that's actually where, like I said, where some of the vomit and the nausea comes from, because there's actually nerves that are on the front of the head, and it actually goes right down to your stomach. So blunt force impact to the front of the head will shut the digestion off. And so that's actually where some of the dizziness comes from. And the body can't calibrate itself. And so that's where some of the dizziness specifically comes from, the body's inability to proprioceptively calibrate where it is in space and time. And so that's, again, from a jarring of the nervous system. And so it's important to also continue to understand that the body has the physical. You have your physical body, you have your physical structure. Here, if we say levels of the body, you have your physical structure, and you have your electrical activity. Your whole body runs on electrical activity. All of your organs, your brain communicates through electrical impulse. Your body is sending electrical communication up and down the spine to the pelvis and back up. Your heart beats on electrical impulse. And so when we have impact, all of this electrical activity can be hampered. And so including your digestion, that's controlled by electrical impulse. Your body's just regulating itself. Your body's just a big circuit board of electrical points. And so that's one of the main things. If your digestion shuts off after an injury, you will not restore your body. So cell regrowth and regeneration. So that also includes out includes clearing out of injury sites. And so if your body can't clear injury sites, you're going to have scarring, you're going to have debris, and your digestion is so important in the body's way of controlling inflammation in your body. And so digestion, many diseases, not just from concussion, but many diseases in itself can arise from underfunctioning digestion. And so that's really important to note, that cranial injuries can shut your digestion off. Number 3, cranial fault misalignments. So from impact to the head, so your skull and your jaw are just a series of bones that are all puzzled together. And so at one time they thought that the skull was just solid, and then they found that there's skull plates, and they come together, and in between your skull plates is cartilage, and when you take a breath, your skull should actually subtly expand, and then will contract. And there's a constant pumping mechanism. This is a cranial sacral theory. Not a theory, this is what it is. Your brain, or your skull, expands and contracts with your breath. And so that's your body pumping fluid and blood up into your skull. And when you have injuries to the head, the cranial plates actually begin to jam and overlap upon themselves. And it restricts the movement of the natural flow and movement and mobility of your skull. And so again, with the idea of being able to clear out injury sites, if your body is not optimally and efficiently pumping blood and fluid up into the brain, and lymph, your body's not going to be able to clear out some of these injuries. And so cranial fault misalignments come from misalignments of the skull plates, and you have to understand that it can put unwanted pressure on certain areas of the brain, nerves that are leaving the skull. And so this is a really important concept as we talk about cranial injuries, understanding how the skull and jaw are structured together. So we'll talk a little bit about more of that in the treatment strategies. Local swelling and inflammation. That's one of the main problems, is inflammation. All pain is an inflammatory condition. And so when we treat the body, we have to understand that we have to clear out inflammation and local swelling. And we can do that with some of these treatment strategies. And that's ultimately where we get the long-term risks, is because your body remains in a perpetual state of inflammation. So if your brain is swollen, you can have also inflammation of the entire nervous system throughout your whole body. And so you can have chronic inflammation that spreads throughout your body, which ultimately will interrupt electrical activity throughout the whole body. And so that is one of the problems of this whole concussion topic, is how do we manage swelling and bruising and inflammation of the brain. And then dural torque. So this also kind of ties right into the cranial fault misalignment. So, excuse me. So your dura is the outer lining of your spinal cord, and so your dura surrounds your spine, and it wraps the spine, and it comes right up into the skull, and it surrounds your brain as well. So this is connective tissue. And so you have your fascia, your muscle fascia, but this is a deeper, thicker connective tissue that protects the spine itself. And when you have injury and impact to the body, you can have a torquing of these connective tissues, which winds the spine. And so you can have, so if you get hit in the jaw, it can be twisted here. So if you're twisted here, and then you can get hit from this side, and so you're like a dish rag. You're being twisted and torqued in all directions. And so when we talk about the natural mobility of the pumping mechanism of fluid up and down your spine, if you have torque in your dura, or if you have inflammation in your dura, this pumping mechanism of blood and fluid up and down your spine into the brain will also be interrupted. And so that's a huge concept of you have to unwind the body. You have to remove all of the compensations. You have to put the body back into alignment. And this dural torque, this torquing of all of your connective tissues, is a main reason why the body will not go back into alignment unless you address it. And so if the body's out of alignment, all of the mechanisms of blood and electrical flow will be interrupted. I say electrical flow, in Chinese medicine it's called qi. So we'll talk a little bit more about that in a second as well. And so, again, this idea of electrical hampering, the electrical activity in your brain will become interrupted. And we have to reestablish neural integrity. And so as your brain is sending electrical impulse out to the rest of your body, it's this electrical, the flow of the wiring, so that can be interrupted. So if you have chronic injuries, the wiring in your body will not communicate with itself, and it will not be optimally regulating itself as well. And so we're trying to, with treatment, we're trying to reestablish neural integrity. It's an important concept too. And so neural integrity begins with establishing communication from your brain. This is just a little picture here. Your brain down your spine into your pelvis and back up. And so there's a constant electrical flow, and that's your center axis of electrical activity, which feeds into the rest of your body. And so that's partly where some of the structural problems come in, or the structural treatments rather, come in, is to reestablish this electrical communication from brain to pelvis, and it allows your body to regulate itself. And so when we talk about the goals of treatment from a concussion, reduce inflammation, you have to promote qi and blood flow to the injury site, to the brain itself. You have to align the skull, the jaw, and the cervical spine, and the pelvis as well. There's a centering mechanism, and you have to regulate electrical activity. All right, and so this is not just a structural problem. Yes, in our scans, you can take an MRI, you can autopsy the brain, and right now our treatment is we're just looking at the structure of the body. But that's like I said, the physical structure. But understand that all of this is powered by electricity. And so that's where some of the treatment strategies come in to regulate all of that. And so our body, a lot of the bruising and the inflammation at local injury sites in the brain come in the capillaries. And so a lot of scans, CT scan, MRI scan, it doesn't pick up the micro damages to the brain tissue. And so we can see local swelling from some of the imaging, some of the scans. SPECT imaging is really good. Those are at the Amen clinics. They're looking at different the electrical activity in the brain itself and predicting symptom manifestation based on interruptions and dysfunctions of certain areas of the brain. And so that's a promising way to begin to diagnose some of these cranial injuries. But right now, the way it is in our current diagnosis of concussion, the main thing that they're trying to make sure is that you're not hemorrhaging, that your brain is not just bleeding out. And so that's where people die from. And so again, emergency medicine. Western medicine has the best emergency medicine in all the world. And so that's the immediate concern is hemorrhage. But in reality, from 100 subconcussive hits, 100 cracks to the head in a single week, you can have, the game is intense. You may have 50 plays, 50 injuries to the head in a single 3-hour setting. And so in your capillary system, you can have interruptions and damaged capillaries, which again, if you have damaged blood veins and capillaries, new blood will not be able to arrive at an injury site. And so this is ultimately where we get our degenerative disease, because new blood flow cannot come to restore the injury site. And so that's important to note. And so when we talk about treatment strategies, okay, you have to stack treatments on top of one another. It's not, again, I'm not going to talk about pharmaceuticals, okay? I'm talking about how do we restore the body with treatment. Number one, okay, I like to use acupuncture. It's a very effective, it's cheap, but it's very efficient at bringing local blood flow to any any area where you insert an acupuncture needle into the body. And so we know, at least locally, like I just said, when you insert an acupuncture needle into the body, wherever it is, it's going to bring blood flow to the area. And so traditional Chinese medicine is all about restoration and trying to put your body back into alignment. And so acupuncture can be a very effective treatment strategy for this problem. I'm not going to get too far into depth about the acupuncture theory. I have other videos for that. So treatment strategy, like I said, acupuncture, you can use acupuncture treatments after to regulate, after a practice, after a concussion itself, you can use it. And so we can use acupuncture to control all of these symptoms. You can control the nausea. You can reestablish the digestion. And then also with the psychological things, you can use it to calm the mind down. And so acupuncture is at the top of the list. Craniosacral therapy. That's soft manual manipulation of the skull to attempt to reestablish the mobility and the opening and closing and the contraction of the skull plates. And so it's putting, and again, it's reestablishing the cerebral spinal fluid mechanism of pumping fluid up and down your spine. So your brain is buoyant and it's surrounded by cerebral spinal fluid. And so and it uses that as a shock absorber too, okay? And so if we can reestablish the alignment of the skull, your body will be able to clear out some of these injury sites along the way. Diet and supplementation. If you're an athlete playing some of these sports, you have to understand the importance and the role of diet and supplementation. So again, you don't want your body in a chronic state of inflammation. And so we can give you nourishing, nutrient-dense foods to help clear out some of the inflammation. We can use supplementation to help to regenerate some of the tissues, and it's so important. And again, it's not an issue of just one concussion. It's not good to get hit. It's not good to have a concussion. All right, but these are some of the best athletes in all the world. Their body can endure so much more than just the average person just walking around. And so, yes, they can endure, but at the risks. So these are the risks, but an athlete today, you need to know what you're getting yourself into, and you need to understand the long-term risks, player education about all of these things, what to look for. I know that's one of the main things right now that college and NFL is they're putting this on the players to come forward and say, no, I'm not feeling right because I just got cracked in the head. And they're putting sensors in the helmets to monitor how many times people are getting hit in the head. But the body is resilient, and the body is it's tough. It can be tough as nails. And some of these boys that play these sports, and women sustain. This is not just men. This is men and women that can all sustain concussion. And so these are some of the best athletes in the world. When your body is in fight or flight mode, you often don't feel pain. You're driven. You're in that elevated state. And so that's important to note as well, is the body, even when you take the impact test. So right now, the way that they often diagnose a concussion on the field is they give you an impact test. So you have a baseline at maybe the beginning of the season, and then when you take this test after concussion, your cognition will be impaired. And so they use that as a tool to measure cognition. And then if your cognition has decreased, then you can extrapolate that you may have sustained a concussion. But again, when you're in that hyper-elevated state, your mind actually can work more efficiently. You can work, your body is in survival mode, okay? And so you can often deceive and trick the test because your body is, it's in a state of it's in an elevated state, and so that's another thing to discuss as well. Number 4 here, I have neural organization technique. So that's an advanced applied kinesiology technique. When I had all my concussions, I would say this was the most powerful thing that helped me overcome all of these injuries and helped re-regulate my body and my mind as well. And so again, neural organization helps to reestablish this communication from brain to pelvis. It centers your body, reestablishes your body's ability to calibrate itself, but it also it's neural reorganization. So when you get hit in the head, the electrical activity can actually get switched and transposed, and the neural reorganization technique can help to reset your electrical activity. And so when we consider the body, it's essentially a circuit board of electrical points on the outside, but there's also wiring within as well. So you have your central nervous system, you have your peripheral nervous system, you have the acupuncture meridian system. So all of this is just electrical activity that's running up and down your spine. When you sustain an injury, your electrical activity will become interrupted, and the body can no longer communicate and regulate itself optimally. And so we have to reestablish optimal electrical activity in the body, not just in the brain, in the entire body. And so this helps to remove some of the chronic compensation mechanisms in your body to protect itself. And so that's a very powerful treatment. And neural organization technique is a new tech. It's a modern technique. It's advanced applied kinesiology, and I encourage anybody that has sustained a concussion to go receive those treatments to help put your body back into alignment. Hyperbaric oxygen therapy. And so when we talk about swelling of the brain, there's been studies that show so hyperbaric oxygen, basically you go into a chamber and you receive pure oxygen that's pumped into the chamber, and the pressure, the atmospheric pressure is increased as well, which helps your body to absorb oxygen. And so you have to have the pressure change in order for your body to absorb more oxygen. So you've seen oxygen bars maybe at the mall. When your body at 1 atmospheric pressure, which is sea level 1, your body can only absorb so much oxygen. But as the pressure increases, your body actually can absorb more. And so we can use oxygen therapy to help clear out free radicals in the brain. It helps to reduce inflammation, and it just helps to re-nourish tissue sites, and it helps to break the blood, not break, but it helps to, the oxygen can seep through the blood-brain barrier, which is often difficult to get through. So that's an effective treatment as well. Cold water therapy, cold showers. So if your body is in a constant state of inflammation, cold water therapy can help quell some of that inflammation. Cold water therapy also helps to regulate the autonomic nervous system. And so if your body is in a constant state of inflammation and swelling and inflammation is always a hot condition. Inflammation always suggests heat within the body. And so the cold water therapy, either ice baths or even cold showers, can help to control and help to manage some of the swelling. Meditation and breath work. Your breath is what powers the mechanism of fluid pumping up and down your spine, and your breath expands the skull. And so often when we're in a state of fight or flight, often we hold our breath as an arming mechanism to prepare for the fight. And so if you can train yourself to breathe properly, you can help to manage some of the perpetual arming mechanisms of your body. But breath work, just like the oxygen therapy, can help to bring new nourishment to sites of injury. And meditation. If you can learn to meditate, it'll help to keep your mind healthy. And they're discovering that your brain has a plasticity, And so you can reestablish and regrow neurons in your brain. And so that's actually a Harvard study. Meditation can help to, again, expand and grow your brain. But you have to understand how to do it. There's so many techniques. I won't get into meditation techniques in this video, but seek them out. It's a good way, not just if you're an athlete. This is meditation can help all people to live a more peaceful, content, and a life with a clear mind. So meditation can really help to help this problem as well. And then number 9, I do have strength and conditioning down here. If you're going to play these sports, you have to train every part of your body. You have to be prepared. Your body has to be strong. One of the main concepts as it applies to this is you have to train your body to be able to support and maintain your posture while you're getting hit. And so on the idea of torquing your body, if you get hit and your body gets twisted up because you're not able to hold your structure, the forces will be isolated in your head, and the whiplash mechanism will also present itself if your body's not strong enough to endure the impact. So strength and conditioning can help to forge the body. It can help to strengthen it, put density into your bones, and it is a way to protect yourself. But on the other end, some of these athletes, they train year-round and then they compete. Okay, so the athlete of today is far more strong, far more powerful than the athlete of maybe 30, 40 years ago because of our advanced understanding of training techniques. And so that's another thing to note in this issue, is that it's these are some of the most powerful athletes in the world, powerful people. Okay, and so when you have a grown individual where their body is fully developed, the speed and power that they can generate it's car crashes, 150 to 200 G's of force of two people coming and running into each other. Your body can endure it, but at a cost. At what cost? So when we break a bone, when we tear an ACL, we can orthopedically put that back into place. But again, we have to stack up all of these treatments to help to address the injuries to the brain itself. And the current treatment strategy right now in the NFL concussion protocol is just take a few days off, go sit in a dark room, maybe some light calisthenics, some light stretching, some light jogging, and then you're just thrown back into the mix. The concussion protocol in the NFL is shit. Okay, your body will not restore itself on its own because of, one, the continuous onslaught of cranial injuries. So the problem with football players and hockey players and rugby players is they're constantly getting hit in the head, all right? And it's not just getting hit in the head, it's getting hit everywhere in the body, which again hampers your electrical activity, stimulates your fight or flight. And so again, your body goes into this hyperactivity of compensation. And eventually everything accumulates, and your body, an overstimulated machine will shut down. And that's ultimately what happens as people get deeper and longer into their careers, is their body can no longer compensate for the injuries. And so sitting in a dark room, yes, your body has an amazing capacity to regulate itself. But if you do this week in, week out, year after year, the body will be in a hyper state of compensation, and eventually it's going to catch up to them. And that's where all of this comes in. You have short term, and then you have long term. And then you have all the psychological manifestations. And so when you're part of a football team, you're essentially part of an army. And so your days are planned, your schedule's planned. One of the main concerns that's actually documented right now is when you retire, a reintegration back into society, often that's a very difficult thing for people to do. What's the point of playing sports if when you're done, you can't think, you can't process. And this happened to myself, actually. I went through a period where I almost flunked out of my undergrad studies. I couldn't calculate math, I couldn't remember things, and I was just in a dazed state, just staring at a professor, attempting to try to remember what he just said 5 minutes ago. And at the time, I didn't understand what was happening to me. And so so the doctors today, in a sense, they're bending over backwards to avoid to say that concussions can cause long-term effects to the body. But we know better. We're beginning to understand all of this inside and out. The psychological manifestations is a true epidemic of all of these players, and so that's why I encourage people to seek help for the psychological conditions that manifest. Understand that they are a real manifestation of a cranial injury. It's not something that is necessarily just a genetic problem. Often people, especially men in our society, our emotions are disregarded. We're supposed to suppress. We're supposed to be tough, and we don't recognize male emotion as valid. And so that's one of the main problems of people that sustain cranial injuries, and we're supposed to be tough. But in reality, emotion is a very real part of an individual. And so if someone is depressed or someone is anxious, all these things can accumulate. And one of the main, in the end, a lot of some of these people that have sustained cranial injuries, they commit suicide. And it's because they can't cope, and they can't understand what's happening to their body. And so that is a very real and very valid problem in this whole discussion is again the psychological manifestations. And so you have to that's why football players and athletes and combat athletes, all of these athletes who sustain cranial injuries, you need to understand what you're getting yourself into. And so, but I'm not a proponent of getting rid of these games. I'm about coming up with solutions. You can learn so much about life being part of a team, and if we risk all these things to the body, and if somebody wants to dedicate their life, a decade of their life to doing this, we have free will. Who's to say? People can die in a car accident, or you can fall, trip, and hit your head and die. Who knows when the good Lord's going to come take you? But understand, if you're going to play these games, you have to take care of your body. The key is restoration. It's not masking the pains. It's not giving you. When I was in school, my doctor said, "Well, you can take 6 ibuprofen at a time. You can do that a few times a day." And that was my treatment for the longest time. I had a constant headache. Couldn't think, couldn't get out of bed. I wanted to sit in a dark room, but I had to go to practice. And so every day we had to go watch film, and then we went out to practice. And then for 3 hours, you're fighting. And so in the end, it caught up to me. My body could no longer compensate. And this happens. I'm not the only one with cranial injury. I'm not the only one who played football with a headache. And so I've used and stacked all these treatments on top of themselves to help restore my body and my mind. And so I was done playing in 2011. Over the past over the past 7 years, I've used all of these things to help restore my body. I still do get headaches every now and again, but because I've used this, I feel like I'm in a far better place than I was 7 years ago when I was playing. And so if I would have implemented all these things and taken care of my body a little bit better, perhaps it wouldn't have gotten to such severity. But ultimately, that's what we're here to do. Is we're here to find solutions for problems in the world. And so again, the key concepts: swelling of the brain. Your brain shouldn't swell. That ain't good. All right. Chronic traumatic encephalopathy, this is the degenerative condition. My opinion is that if we can get and reestablish optimal blood flow to injury sites and to help clear the scarring out of the brain and to reestablish the brain's communication with itself as far as from an electrical standpoint and realign the skull, it will limit the long-term effects of some of these cranial injuries. And so that will be to be determined. We don't know yet. This chronic traumatic encephalopathy with these tau proteins and these protein accumulations of which where basically it eats away at the brain. We don't know if the treatments will help to quell that. But my take is if we can reestablish your body to optimal polarity and equilibrium, if we can remove the compensations from treatment, the body will restore itself. You just have to put it back into alignment. This is different than a chiro adjustment. Okay, so again, that they're only focused about structural. So I'm talking about deep energetic realignment, reestablishing electrical communication, and to bring new nourishment to sites of injury. And so this, you can also studies on stem cells. That's another way to clear out scarring and dead tissues. And so I think that'll be part of the topic of discussion as well. So the brain is free floating. This is not a helmet issue. I repeat, this is not a helmet issue. Good helmets make you more reckless with your body, as I stated earlier. And so we cannot control an uncontrollable game. Your body will sustain cranial injuries to the body from concussive and subconcussive hits. Okay, anywhere from 15 G forces, which is a solid crack. Your body will be manipulated. Okay, and then on the other side of the spectrum, 150 Gs, 200 Gs of force. So some of these athletes are enduring car accident after car accident. Okay, but because they're such powerful athletes, they can endure this. Okay, so like I said, the average person who would go through a car accident can have back pain for years. Some of these athletes, they can get beat up and they can endure. And so if you're going to play these games, you have to take care of your body while you're playing, but you also have to take care of your body when you retire. Okay, that's one of the main problems I have with the current system of college athletics is when you're done playing, they just send you on your way. They don't help you to restore your body and your mind after retirement. And that's where some of the PTSD symptoms actually arise because they don't, and their problems reacclimating back into society. That's where some of those problems come into play, is because they don't know how to navigate. And how can a person navigate if you have a dysfunction of the brain? And so you have to address it. Okay, you have to address the physical damages. You have to address the psychological manifestations as well. Okay, so I know there's people out there right now that are lost and they don't know what to do. They don't know what's happening to them, and that's why I offer insight. I wanted to share some of my experiences. Stack up these treatment strategies. Take care of your body. Understand that there's resources that you can use. And so when we talk about implementation, so I run a private medical clinic now. How do we implement some of these treatment strategies at the collegiate, the professional level? So professional athletes, because they get paid a lot of times, and they have money to do so, they can hire private practitioners to implement these things. Okay, college athletes, they do not get paid, and they're under the supervision and medical care of the current doctors. And they're using Western medicine, alternative medicine, or they're not using alternative medicine. That's the problem, is because they throw medications at the concussion problem, but it's not restoring the injury. And so when we talk about implementation, I think number one, youth football and youth contact sports should be limited to either flag or non-contact. Your body is so delicate at that age, all right? And so again, CTE is not limited to age. So an 18-year-old was found to have a degenerative brain disorder. How can you go through life with your brain eating away at itself? Again, this is a real problem. 1 million high school football players every year are sustaining cranial injuries. How can a person with a cranial injury go on to college, go on to have a career if your brain is not functioning properly? Okay, and so we have to implement some of these things at the college level. We have to get rid of youth contact sports, and so we have to understand that. And number two, we have to understand that it's not just a single concussion. Okay, in a practice, you may not have a concussion, but you certainly got hit in the head, and you certainly got your head jarred. And so that in itself can hamper your electrical activity. That itself can put you in that state of fight or flight. And so in that hyperactive state. And so again, as people retire or live their life that play these sports, these combat sports, the body and the mind cannot distinguish between competition and real life. And so that's where actually sometimes you see people with domestic violence, bar fights, addiction. These are psychological manifestations. I'm not condoning these things. I'm saying these are a result of brain trauma, all right? And so that's where stacking up treatment strategies, understanding player education to get them to look for all these things is also important, all right? And so, yeah, like I said, this is a little video on concussions, the concussion problem. If anybody has any questions, feel free to reach out. My practice is in Southeast Wisconsin, Integrated Heights Healing and Wellness Center. I am trained in all of these things, all right? Don't feel lost if you have a cranial injury. I know some people are suffering from this exact thing. I've talked to former players that I've played with. There's so many people that are dealing with this exact same problem, and they don't know what to do. And then if you go to a Western doctor, they're going to throw medications at it. But again, medications and pharmaceuticals, they don't restore the body. They don't restore injury sites. They don't reestablish electrical communication in your body. And so, like I said, if anybody has questions, please feel free to reach out. I just want to be a resource of knowledge and insight on this topic because I myself have gone through many of these things and I've overcome many of these things, and I've studied this in depth, and I do think that there's solutions to it. I don't know how it's all going to play out. In 20 years, they may rid the world of football, but there's so much money involved. And there's so many powerful people that are controlling it. And another thing, the people that are implementing the concussion protocols at the NFL level, they're not necessarily doctors, okay? The coaches aren't doctors. The owners of the team, they're not doctors. They don't understand the problem. These, a football team, you got a group of men coming together from all over the country, pooling their energy together and trying to compete in this game. But the owners and coaches of the team, they're just trying to win football games. They're trying to compete and trying to be the best that you can be. And that's ultimately why this is such a powerful game that can teach you about life. But you can't go through life if your brain is eating away at itself. And those are the risks. And so you have to look to restoration. And so I think we'll call it there. Thank you for listening. I hope this brought some insight and knowledge onto this topic.